Hello, I'm Leah. I'm going to be your medical assistant today. First thing you want to do is you want to verify your patient's name and date of birth. And today I'm going to give an example of emergency case scenario. The scenario is of, her name is Cecilia. She comes to your primary care client. She is 37 years of age. She's coming in for an IUD insertion because she no longer wants any more kids. She's had all her IUD pre-scheduled a week ago and everything came back negative. She took the bus to the clinic. After getting up on the table, she starts to have left chest pain, which feels like a rapid pounding in her chest, with pain rates at 5 out of 10. The pain radius in her left arm and feels like pressure. She is somewhat panicky, but has no tingling in her fingers or around her mouth. She feels mildly nauseous. She develops mild shortness of breath after about 10 minutes of chest pain. She gets slightly dizzy after a few minutes. When asked her medical history, she has high blood pressure, high cholesterol, and smokes about a pack and a half a day. She is mildly obese and has a sedentary lifestyle and does not do much exercise. The bus is about the most she's done. She has a history of rapid heartbeat as well as amphetamine use, but not in the last week. She has 2 cups of coffee this morning. She is not a diabetic. Her father died of heart attack at the age of 50. Her medications include a high blood pressure medication, but she ran out a couple of days ago, and cholesterol medication. Her vitals her pulse is 150. Her pulse is 150, her blood pressure is 145 or 85, her temperature is 98.6, and her O2 saturation is 98. 5 minutes later, pulse is 160, her blood pressure is 150 over 95, her O2 saturation is 95%, her EKG shows suprareticular with a rate of 155, but no typical changes associated with heart attack and no wide QR complex. So now what I want to do is I want to get the patient comfortable, make sure she's laying down comfortable, and I want to ask her again what her chest pain is, 1 out of 10. And I want to get another medical assistant to go gather the doctor up for me. Never leave your patient by themselves. So as the other medical assistants getting the doctor, I'm going to stay with them. And so the doctor can call EMS, and we're going to wait for EMS to arrive.